Hello everyone, welcome to the channel Health for All. I am Dr. Arijit Banerjee and today in this video I will discuss on high blood pressure and its new cure found by the researchers worldwide. I am sure you will love to know this and it's very easy to implement and follow to control your high BP. So stay tuned with me to know more and subscribe the channel if you haven't already to get this kind of latest scientific information. High blood pressure is a serious medical condition that affects billions of people around the world, also known as hypertension. Hypertension increases the risk of heart disease, brain stroke, renal failure and other problems. As per the peer-reviewed journal The Lancet, 60 to 70% of Indians with hypertension are unaware of their conditions, leaving them predisposed to life-threatening conditions. Again, it was found heart disease and stroke contributed to nearly 28.1% of total deaths in India, and that figure has been rising and rising. The problem is hypertension is mostly either undiagnosed or untreated, or proper measures to control high BP is not being followed because it does not produce any symptoms in the early stages and remains as a silent disease for a very long period of time. So, what does high blood pressure mean? The blood pressure is measured using two numbers. The first number, called systolic blood pressure, represents the pressure in your blood vessels when your heart beats. The second number, called the diastolic blood pressure, represents the pressure in your blood vessels when your heart rests between the beats. A blood pressure measured in millimeters of mercury equal or less than 120 by 80 millimeters of mercury is considered normal for general adults, where more than 140 by 90 millimeters of mercury is considered hypertension. Prolonged high BP is a serious and might be a life-threatening condition, but the good news is that lifestyle changes can significantly reduce your numbers and lower your risk of high blood pressure. Generally, high blood pressure often has no symptoms. Over time, if untreated, it can cause health conditions such as heart disease and stroke. But in this video, I will tell you 3 dangerous high blood pressure symptoms that not to be ignored. Number 1, chest pain, mostly in left side, squeezing tight. Number 2, headache. Mostly pain comes from the nape of the neck and throbbing in nature. And number 3, dizziness and shortness of breath. If you have any of the above symptoms, please consult to your nearest doctor as early as possible. So, what's the new method of cure? Now, most of you know that exercise, healthy diet and less salt are the good habits to reduce blood pressure. However, the latest research shows that a simple lifestyle change can decrease blood pressure significantly, and that is a midday nap. Yes, you are hearing right. It's a midday nap. A new study shows that taking a short 20 to 40 minutes nap during the day helps significantly reducing blood pressure level. For each hour you nap, systolic blood pressure drops on an average 3 millimeters of mercury, where taking a low dose of blood pressure drug can lower your level of blood pressure on an average 5 to 7 millimeters of mercury. A simple nap can reduce overall 5 mn of mercury of blood pressure as per the new study. For the study, the investigators collected data from lots of people with a mean age of 62 years and whose systolic blood pressure was high. The study also took the risk factors such as consumption of alcohol, smoking, coffee, salt intake, the participants' physical activity, gender and taking regular medications. The researchers compared blood pressure over a period of long time among those who napped in the middle of the day for about 30 to 50 minutes with those who didn't. Surprisingly, researchers found those who napped significantly had on an average more than 5 millimeter mercury lower systolic blood pressure than those who didn't. Surprising, right? So, the findings of the study are significant and promise to introduce a new lifestyle which can impact our overall health. But obviously, I don't want to encourage people to sleep for hours in the daytime, right? But on the other hand, people should not feel guilty if they take a short nap. In addition to the midday naps, your blood pressure readings are what you eat. Reducing your salt intake, eating more fruits and vegetables, keeping alcohol to a limit, regular exercise, meditations, regular medical checkup are also the things that are essential to have a normal blood pressure. The new cure method of high BP is interesting, right? We all love to sleep, and when it helps to reduce the high BP is wow. So that's all for today. If you have learned something new and enjoyed the video, like, share and subscribe and turn on notifications so you never miss a video. Take care.